Okay, so we've gone through and discussed the innate immune system a bit. We've discussed the adaptive immune system. And now we're going to spend some time talking about inflammation, which is really a part of the innate immune system, right? It's the process where the body responds to a foreign antigen or an infection with a very typical response to clear the foreign infection, to heal the tissue, um, and then the inflammatory cycle um, goes down and resolves. Okay, so now there are conditions called autoimmune diseases where the the inflammatory cycle recognizes certain parts of the body as foreign, and those are called autoimmune diseases. And we'll talk about many of those in coming modules where uh, the body produces antibodies that target its own tissue and creates all kinds of diseases because of the organs that are injured. Okay, so that's for another time. But let's look at the cardinal signs of inflammation. Okay, so let's go back to that wound on the arm that's been cut, and uh, uh, infection developed, say, and inflammation developed. Well, what's inflammation? Well, redness, because the mast cells released histamine and caused vasodilation and allowed fluid to leave the blood vessels and cells to leave the blood vessels to attack the foreign antigens. Heat. Well, the heat is from the increased blood flow to the area, right? So it's red because there's more blood to the area. There's heat because there's more blood flow to the area. Swelling because there's tissue fluid now. Blood the blood vessels have allowed fluid to leave them and accumulate in the tissue, which is part of the inflammatory process. And when you have more fluid, it brings cells that not only clear the antigen, but clear the infection. Okay. Pain. So there's nerve fibers throughout tissues, and those nerve fibers are responding to some of the chemical irritants that we'll talk about that are being released by the white blood cells, such as bradykinin, histamines, prostaglandins. And that's partly why we use anti-inflammatory medications, such as ibuprofen, for inflammatory, painful conditions, because they block the production of prostaglandins. Okay, so these chemicals that have been released into the tissue are directly responsible for pain. Loss of function, partly due to the pain and partly due to the swelling or edema to the area. Okay, so these are the cardinal signs of inflammation: redness, heat, swelling, pain, and loss of function. Okay, so let's just get the big picture of acute inflammation. It's to initially destroy or attack any offending agents, such as infection or foreign substances, such as dirt in a wound. There's going to be inflammation to try and clear the injury and also potentially the infection. Wall off and localize the area, okay? And that's where the swelling is going to come in. It's going to wall off the area with tissue edema. The clotting system with platelets are going to come in and stop the bleeding in the area. Okay, they're going to form a platelet plug. The inflammatory process is going to release cytokines and factors that go into the bloodstream to let the adaptive immune system to be activated, right? To tell the adaptive immune system that, oh, by the way, the innate immune system in the inflammation has been turned on. We will likely need you as well to bring in specific targeted immune system treatment, okay? And then finally, once that's been dealt with, once the infection and the inflammation has occurred, now there's tissue healing through multiple types of growth factors. There's the fibroblasts that now want to come in and heal the tissue and produce new collagen, okay? So new blood vessels will form in the area where it's been injured, tissue regeneration, and potentially even scar formation, okay, through production of fibroblasts that make collagen. Okay, so acute inflammation we'll talk about on this slide. I'm going to keep on staying with acute inflammation for a while, and then we'll go to chronic inflammation, where the inflammatory system doesn't shut down for a number of reasons. One of them being, say, an autoimmune disease, where the body has formed inflammation and an immune attack on itself to specific organs. Okay, so there's autoimmune diseases that set up chronic inflammation. Chronic inflammation can also occur if there's a non-healing wound. So say somebody has an ulcer on their leg, or an infection in their bone after they fractured their bone and it came through the skin and got infected and now has developed chronic inflammation. So we're going to stick to acute inflammation. So acute inflammation is typically from an injury to the tissue that stimulates the inflammatory response, or of course an infection, right? Any infection that's been introduced into the body is going to set up an inflammatory response as part of the innate immune system. So what are the characteristics of acute inflammation? Well, it's immediate. So the mast cells releasing histamine, the macrophages in the tissue, phagocytosing, engulfing antigens and bacteria. So it's an immediate response. The neutrophils coming in from the bloodstream to fight the foreign invader or to help with the inflammatory process. It happens within minutes to hours, right? Non-specific, meaning every time you twist your ankle, you're going to get the same response. Redness, pain, swelling. It's non-specific. It's going to repeat the same cycle every time. There's no memory to it, okay? So if you get an infection of your skin 20 times, the inflammatory cycle will respond the same way every time. And it's typically self-limiting. So once the foreign substance or the injury has started to heal, and the mast cells and the neutrophils and the macrophages have performed their function, and now the fibroblasts are healing the area with new collagen, for example, the inflammatory cycle starts to shut down. So it's a very self-limiting process, okay, which is good because you don't want inflammation to continue when you don't need it any longer. Okay, so here are the local manifestations of inflammation, right? So, say for example, this person has sustained some kind of an injury to the area, say a concrete block landed on his leg. Those are all signs of inflammation from tissue injury, right? So the redness, which is from the vasodilation and the release of fluid into the area from the bloodstream. The heat, again, from vasodilation and fluid release. The swelling, fluid release from the vasodilated blood vessels. Pain from all those chemical mediators that have been released by cells, such as macrophages releasing histamine, neutrophils releasing prostaglandins, and they irritate or stimulate the sensory fibers that lead to pain. And of course, the loss of function because of the pain and the swelling. Okay, so inflammation doesn't necessarily mean infection. Inflammation can be a process that's part of an infection, but inflammation can occur without infection, right? Say from an injury. So don't equate inflammation always with infection, okay? But the opposite would be true. An infection would have inflammation with it. So when thinking of inflammation, think of it as anything that injures the tissue, right? So whether you've stubbed your toe, or you've dropped a box on your foot, or you've twisted your ankle, or you have an infection somewhere, inflammation is going to set in, right? It's a process to heal tissue and to deal with potential infection. So inflammation, I mentioned before, is divided into acute and chronic. We're spending most of our time right now on acute inflammation, which is this short-term process that occurs in response to tissue injury or infection. And it often appears within minutes to hours of either one of those happening, okay? And we went over the main signs of acute inflammation being pain, redness, immobility, swelling, and heat. And make sure you understand where those come from, right? What's the process that causes those 5 cardinal signs? Chronic inflammation is a very slow, persistent, long-term inflammation that has been going on for months to years, okay? And it's typically in response to something that's non-healing, or we reserve this term also for autoimmune diseases, where the body's immune system just persistently attacks itself. Okay, and we'll come to that. Okay, so this slide, again, just what stimulates acute inflammation? Any type of tissue injury, say to the skin or to any particular organ. Say you have an infection in your kidney. That's called pyelonephritis, a bacterial infection of your kidney. Well, that's going to lead to acute inflammation as the initial response, right? How about allergens? So environmental allergens, such as seasonal allergies, some medications, some foods, insect bites, the body can react to any of those with inflammation. Okay, so an allergic reaction to a medication is a form of inflammation. A stuffy nose with nasal congestion from environmental allergies, that's inflammation. A food allergy where you develop hives or urticaria, a rash all over your body, that's a type of inflammation. Okay, insect bites. Insect bites rarely get infected, but they cause an area of itching, redness, and swelling because of the inflammation. Okay, so just remember, inflammation is from anything that leads to tissue irritation or injury, and of course the last one, infections, whether it's bacteria, viruses, fungi, parasites. Any of those will cause the inflammatory system to be activated. Okay, so let's discuss the typical inflammatory response. Okay, and remember, inflammation is part of the innate immune system. So there's either tissue injury or tissue infection. That can be on your skin, that could be in your kidney, that could be from having been in a car accident, and there's going to be inflammation because of the tissue injury or the cellular injury. That causes mast cells, which are in the tissue, to release histamine. Okay? Histamine locally in the tissue causes vasodilation and increased capillary permeability. It allows fluid to leak out of the blood vessels. And what does that allow? Well, it pours tissue fluid to the area. It allows neutrophils, which are a type of leukocyte, to come into the area because the fluid is leaking out. And it also, the damaged cells will release chemotactic factors. And chemotaxis, remember, is just the attraction of other cells because of chemicals, okay? Chemical mediators. And they are telling the neutrophils, please come and help. We've been injured or we have infection here. Okay? The increased blood flow will cause redness and heat, while the increased permeability of the blood vessels cause edema and as well tenderness at the site. Okay, so if we're talking about a skin infection, say someone has a cellulitis, which is a skin infection. Well, there's going to be inflammation at that site, okay? And this whole process will take place. So the big players in inflammation are mast cells, macrophages, and neutrophils, because they mobilize very quickly, leading to all those inflammatory signs that we had on an above slide, right? The heat, the redness, the swelling, the decreased function. Those are all signs that have occurred very quickly because of the inflammatory cycle. Okay, so this slide gives a nice sequence as well of inflammation. So there's been some kind of a tissue injury. Say somebody poured a toxic chemical onto their skin and burned the skin. Okay, so immediately there's going to be vasodilation of the area because the mast cells have released histamine. That increases the blood flow to the area. Histamine also causes increased vascular permeability, which will allow fluid to be released into the tissue. The mast cells and those macrophages that have the ability to engulf antigens or cells and destroy them, they can release cytokines. Cytokines are going to tell neutrophils, which are a type of leukocyte, to come to the area. So it's always the neutrophils that come first, which is a type of white blood cell, to an area of inflammation. Okay? And then finally, with all those chemical mediators, such as histamine, prostaglandins, leukotrienes, when they go into the bloodstream, you're going to get a systemic response, such as fever and even an elevated white blood cell count in your bloodstream, because you're fighting either an inflammatory response, or you have an inflammatory response, or you're fighting an infection. Okay, so understand where all of those signs are coming from: the heat, the redness, the swelling, the tenderness, and the pain. Okay. Okay, so here's a slide comparing acute inflammation versus chronic inflammation. So the onset of acute, fast, minutes to hours, right? The mast cells, the macrophages, the neutrophils, the release of cytokines, the vasodilation leading to the warmth, the tissue edema, the redness, the pain, right? Happens very quickly. What are the main cells involved? The main cells are mast cells, macrophages, and neutrophils. Those are the main cells. What's the cell that comes out of the bloodstream to deal with acute inflammation to help out? Well, that would be the neutrophil, because neutrophils are typically in the bloodstream. The tissue injury, it's usually something that's self-limiting, right? So you hit your finger with a nail, with a hammer, and now you have inflammation at the area. Not necessarily infection, just inflammation. Okay, local versus systemic. So local and systemic signs can be very prominent with acute inflammation. So if you have a significant pneumonia, a large pneumonia in your lung, you're not only going to have local signs such as coughing, shortness of breath, sputum production, but you're going to have systemic signs, fever, elevated white blood cells. You're going to have elevated inflammatory markers that we'll talk about in the bloodstream, because the inflammation has gone from a local infection, say in the lung, if we're using pneumonia, to a systemic response. The whole body has become involved. Chronic inflammation, it's slow. It takes typically months to years, and it's usually ongoing, right? What are the main cells that come in the area? Well, macrophages and some of the and lymphocytes. Remember, lymphocytes are part of your adaptive immune system, so they take weeks to months to really infiltrate an area with chronic inflammation. So it's those B cells and T cells, and that's why you see them more in an area that has chronic inflammation. Okay. The tissue injury, it's often a severe injury, or it's a progressive and not it's a not responsive type of process. So it's an ongoing inflammation that's festering. So I used a bone infection such as osteomyelitis as an example of chronic inflammation. Okay, something that's just not settling. The immune system is not turning off. Okay, local and systemic signs have typically started to shut off. You don't typically have ongoing fevers for months and months compared to acute inflammation, where you typically do have a systemic response.